The member from Elgin, Middlesex, London.
Thank you very much, Mr. Speaker. Speaker, my question is to the Minister of Health and Long-Term Care. Speaker, the number of diabetics in this province has more than doubled. Thousands of diabetics every year across the province develop a foot ulcer that unfortunately never heals and leads to amputation. The healthcare costs associated with annually from foot ulcer complications is about $400 million. In fact, due to foot ulcers, diabetic patients stay in hospitals up to 72 days, costing the healthcare sector millions of dollars. Speaker, through you to the Minister, why are offloading devices proven tools that heal foot ulcers still not available through the Assistive Devices Program?
Thank you. Minister of Health and Long-Term Care.
Well, Mr. Speaker, it's a great opportunity, given that it's World Diabetic Week, to actually speak to this issue. And I thank the member opposite for asking this question. And I want to begin by commending the work of all of those who advocate for and provide support for, and of course, including those individuals like my sister, one of those rare insulin-dependent diabetics. She's almost going to have diabetes for 50 years, Mr. Speaker, which would have been unheard of. So this is an issue that's very important to my heart. And it's also the issue of offloading devices and wound care generally is also extremely important to me. And for that reason, I've had a number of meetings with regards to this issue, and I actually constituted through HQO a task force, a expert panel, which is looking at this exact issue, looking at the evidence, best practices, and I think they're just about to report back to me in terms of their recommendations.
Supplementary.
Thank you, Speaker. Back to the Minister. Speaker, every 4 hours a diabetic loses a foot. Public funding for offloading devices is a cost-effective treatment intervention for Ontario. Funding for offloading devices can save the government up to $75 million annually. Speaker, why hasn't this government acted quicker? They continue to pay the $70,000 associated with a foot amputation rather than make investments towards preventative care for diabetic patients. Mr. Speaker, the government has wasted millions of dollars on the diabetes registry and billions of dollars on e-health. Now there's an opportunity for this government to save the system now while improving the life of diabetic patients. Speaker, when exactly will the minister commit to providing diabetics with offloading devices?
Thank you. Minister.
Well, Mr. Speaker, I don't think there's any distance between myself and the member opposite on this issue. I agree with the cost-effectiveness of offloading devices. I agree that the clinical evidence is profound in terms of the potential benefit, but I would hope that the member opposite would also agree that it's prudent for me to wait just a short amount of time, because I think they're about to report back to me a committee, a task force through HQO that includes experts from the Registered Nurses Association of Ontario, the experts in wound management care, the association nationally that represents them, all of the right people to provide us with that expert advice so we can move forward based on that best evidence and best practices. But I want to thank the member opposite for raising this question today.